The World Health Organization and U.S. Centers for Disease Control and Prevention advise the public be watchful for fever, dry cough and shortness of breath, symptoms that follow contraction of the new coronavirus known as SARS-CoV-2. From infection, it takes approximately 5 to 12 days for symptoms to appear. Here's a step-by-step look at what happens inside the body when it takes hold. Coronavirus infection. According to the CDC, the virus can spread person to person within 6 feet through respiratory droplets produced when an infected person coughs or sneezes. It's also possible for the virus to remain on a surface or object, be transferred by touch and enter the body through the mouth, nose or eyes. Dr. Martin S. Hirsch, senior physician in the Infectious Diseases Services at Massachusetts General Hospital, said there's still a lot to learn, but experts suspect the virus may act similarly to SARS-CoV-2 from 13 years ago. It's a respiratory virus and thus it enters through the respiratory tract. We think primarily through the nose, he said. But it might be able to get in through the eyes and mouth because that's how other respiratory viruses behave. When the virus enters the body, it begins to attack. Fever, cough and other COVID-19 symptoms. It can take 2 to 14 days for a person to develop symptoms after initial exposure to the virus. The average is about 5 days. Once inside the body, it begins infecting epithelial cells in the lining of the lung. A protein on the receptors of the virus can attach to a host cell's receptors and penetrate the cell. Inside the host cell, the virus begins to replicate until it kills the cell. This first takes place in the upper respiratory tract, which includes the nose, mouth, larynx and bronchi. The patient begins to experience mild version of symptoms, dry cough, shortness of breath, fever and headache and muscle pain and tiredness, comparable to the flu. Dr. Pragya Dorpadal and Dr. Amit Munshi Sharma, infectious disease specialists at Geisinger, say some patients have reported gastrointestinal symptoms such as nausea and diarrhea, however it's relatively uncommon. Symptoms become more severe once the infection starts making its way to the lower respiratory tract. Pneumonia and autoimmune disease. The WHO reported last month about 80% of patients have a mild to moderate disease from infection. A case of mild COVID-19 includes a fever and cough more severe than the seasonal flu but does not require hospitalization. Those milder cases are because the body's immune response is able to contain the virus in the upper respiratory tract, Hirsch says. Younger patients have a more vigorous immune response compared to older patients. The 13.8% of severe cases and 6.1% critical cases are due to the virus trekking down the windpipe and entering the lower respiratory tract, where it seems to prefer growing. The lungs are the major target, Hirsch said. As the virus continues to replicate and journeys further down the windpipe and into the lung, it can cause more respiratory problems like bronchitis and pneumonia, according to Dr. Raphael Visaidi, infectious disease specialist at Johns Hopkins Medicine. Pneumonia is characterized by shortness of breath combined with a cough and affects tiny air sacs in the lungs, called alveoli, Visaidi said. The alveoli are where oxygen and carbon dioxide are exchanged. When pneumonia occurs, the thin layer of alveolar cells is damaged by the virus. The body reacts by sending immune cells to the lung to fight it off. And that results in the linings becoming thicker than normal. As they thicken more and more, they essentially choke off the little air pocket, which is what you need to get the oxygen to your blood. So it's basically a war between the host response and the virus. Depending who wins this war, we have either good outcomes where patients recover or bad outcomes where they don't. Restricting oxygen to the bloodstream deprives other major organs of oxygen including the liver, kidney and brain. In a small number of severe cases that can develop into acute respiratory distress syndrome, ARDS, which requires a patient be placed on a ventilator to supply oxygen. However, if too much of the lung is damaged and not enough oxygen is supplied to the rest of the body, respiratory failure could lead to organ failure and death. Visidi stresses that outcome is uncommon for the majority of patients infected with coronavirus. Those most at risk to severe developments are older than 70 and have weak immune responses. Others at risk include people with pulmonary abnormalities, chronic disease or compromised immune systems, such as cancer patients who have gone through chemotherapy treatment. Visidi urges the public to think of the coronavirus like the flu because it goes through the same process within the body. Many people contract the flu and recover with no complications. People should remember that they are as healthy as they feel, and shouldn't go around feeling as unhealthy as they fear. Why social distancing is critical to curbing the coronavirus pandemic.
Social distancing is the public health safety intervention used to stop or slow down the spread of a highly contagious disease.
Social distancing means changing how we greet people, moving away from contact.
In other words, it's not just an excuse to avoid your boss or ghost your dates. Social distancing involves restricting when and where people gather to limit exposure. Public health officials will ask that the public keep at least 6 feet away from each other, especially from those who are sneezing or coughing. That, of course, requires the honor system and people stepping up their Good Samaritan game. The intended impact of social distancing is to reduce the number of infections and slow the rate of the epidemic. That helps buy time to develop a vaccine and prevents the healthcare system from getting overwhelmed all at once. Social distancing during the 1918 Spanish flu helped some U.S. cities slow down the pandemic, but their success depended on how soon those measures were adopted and how slowly they were lifted. Quarantine and full isolation are other measures local officials can take to protect public health and safety. And of course, there are the basics we can and should all practice.
There is increased activity in flu this season compared to last season. They do expect to see more cases of co-infections. Flurona is not one disease. It is 2 infections happening in one person. Flurona is basically a co-infection of influenza and SARS-CoV-2, which is the virus that causes COVID-19. Co-infections with any viruses or pathogens have existed before COVID-19. It's not clear whether it would cause more severe disease, but the good thing is that there is treatment available for both viruses, SARS-CoV-2 and the influenza virus. Doctors are basically just going to treat them simultaneously. Another silver lining is that actually co-infections, especially with influenza, are relatively rare. Experts are saying that this twindemic scenario is unlikely to happen. Flu was virtually non-existent last year because of all the masking and social distancing and people staying indoors. So there wasn't a lot of opportunity for people to get the flu, let alone get the flu and another virus. Experts speculate that they can see more cases of co-infections of influenza and SARS-CoV-2 this season as we start seeing flu cases rapidly rise and we start to see COVID cases rapidly rise, driven largely in part by the Omicron variant, which is highly transmissible. The number one thing that experts are saying is to get vaccinated for COVID-19, get boosted if eligible, and also get your flu vaccine, which you can do both at the same time. The CDC says that it's safe to co-administer the flu vaccine and the COVID vaccine. So you can kill 2 birds with 1 stone.